Welcome to SLP Nerdcast. I'm Kate.
And I'm Amy, and we appreciate you tuning in. In our podcast, we will review and provide commentary on resources, literature, and discussed issues related to the field of speech-language pathology.
You can use this podcast for ASHA professional development. For more information about us and certification maintenance hours, go to our website, www.slpnerdcast.com. SLP Nerdcast is brought to you in part by listeners like you. You can support our work by going to our website or social media pages and contributing. You can also find permanent products, notes, and other handouts, including a handout for this episode. Some items are free, others are not, but everything is always affordable. Visit our website, www.slpnerdcast.com, to submit a call for papers to come on the show and present with us. Contact us anytime on Facebook, Instagram, or at info@slpnerdcast.com. We love hearing from our listeners, and we can't wait to learn what you have to teach us.
Just a quick disclaimer, the contents of this episode are not meant to replace clinical advice. SLP Nerdcast, its hosts, and its guests do not represent or endorse specific products or procedures mentioned during our episodes unless otherwise stated. We are not PhDs, but we do research our material. We do our best to provide a thorough review and fair representation of each topic that we tackle. That being said, it is always likely that there is an article we've missed or another perspective that isn't shared. If you have something to add to the conversation, please email us. We would love to hear from you.
Before we get started in today's episodes, financial and non-financial disclosures, I am the owner and founder of Grand Bois Therapy and Consulting, LLC, and co-founder of SLP Nerdcast. Amy Wonka is an employee of a public school system and co-founder of SLP Nerdcast. We're both members of ASHA SIG 12 and both serve on the AAC Advisory Group for Massachusetts Advocates for Children. I am a member of the Berkshire Association for Behavior Analysis and Therapy, Mass ABA, the Association for Behavior Analysis International, and the corresponding Speech-Language Pathology and Applied Behavior Analysis Special Interest Group. Hooray. I think I always say hooray when we're done with the intro.
Exciting to be done with that part of it, I think.
I guess. Yeah. Just like the reading of the script. So what are we talking about today?
We are talking about behavior management, part 1.
It's part 1. It's part one. So when we were going through all of this content, we realized that managing behavior in our field is dense. There's a lot out there. There's a lot of resources out there. There's a lot of information out there, and we couldn't possibly squeeze it into one hour episode.
No, even though we had the lens of behavior management basics.
Yes.
We still couldn't squish it all down.
We wanted to do just like a little skim the top.
Mm-hmm.
Couldn't do it.
Couldn't do it. I mean, we could.
We just
not in one episode.
But not in one episode. And I think that we came to that decision because over the years, with our combined too many years of experience, we realized that managing behavior is a lot of times a cornerstone to a successful therapeutic experience, because I always felt like I can't teach you how to communicate if I can't get you out from under the table. That was my whole spiel to my husband when I was trying to convince him to let me go back to BCBA school was, with my particular set of clients, I was ineffective as a speech pathologist because I spent so much of my time trying to better manage behavior.
Well, and I think even not thinking population specific, when I did my CFY, I was in a big community clinic and I had a pretty diverse caseload. But there are always things that having this framework, this behavioral framework, there are always things that you can do, even if you're not, trying to get somebody out from under a table, but just trying to get the most meaningful and effective session in that you can get in. There are little tweaks that you can make to just make sure that you're really maximizing that person's experience with you.
I think that's such a good point. And so to sort of piggyback on that, using some of these tweaks to make it fun, to make it a valuable experience, to provide a lot of reinforcement, and make it engaging. I think looking at things through a behavioral lens can really enhance a lot of those things. So sort of using that into our next segue, knowing that this is going to be a two-parter, So you can use this episode for one ASHA CMH and the other episode for another ASHA CMH. And obviously that's 1 + 1 is 2. So the whole behavior management package will be 2 ASHA CMHs, but sort of thinking about why we chose this topic. We feel like while it has been a personal, it has really enhanced our practices um, as professionals. Using behavior management has enhanced our practice as professionals. There's a high comorbidity between communication disorders and behavioral disorders that is documented in the literature. One article in particular by, I'm going to pronounce their last name terribly wrong, Durden et al. From 2012, reference on our website. Approximately 50% of children with autism spectrum disorders have behavioral problems. And it's not just toddlers either, right? We always think of, oh, you're an EI or you're working with, individuals on the autism spectrum who have a high comorbidity of behavioral issues. But it's not just toddlers, it's not just young children, and it's not just complex communicators. There was another article we read by Courtney Karasinski. I hope I said that properly. Reference on our website. And this was a really interesting read titled Behavior Problems and Social Functioning in Adolescents with Language Impairments. It was published in Perspectives. And it's all about the importance of teaching adolescents pro-social behaviors to specifically replace unwanted behaviors, because adolescents with language impairments get so often labeled as naughty, or they may have run-ins with the law, or they get labeled as these quote bad kids with poor behavior, and it's really an underlying language impairment that is a contributing factor to that behavior.
And I think connected with that too, when we think about behavior problems, a lot of times what comes to mind first are sort of those externalized behaviors like hitting or hiding under the table or swearing or things like that. But you may want to work on more subtle behaviors too. Like maybe the person just isn't very engaged. Maybe they're avoiding some tasks, not necessarily in some horrible, outlandish way, but just subtly. Are there things that using a behavioral framework might make you change your practice a little bit to increase that engagement? So there's a lot there.
And I think that's also such a good point that sometimes it's not something that's overt, sometimes it's covert. So maybe it's just not, it's mostly avoidance. So they're not participating, and you want them to participate more because of some sort of, and there, it's the absence of the behavior. It's the absence of the participation that you really want to improve. I also would be willing to bet that because of this comorbidity, most SLPs, particularly in pediatrics, are going to run into behavioral challenges in therapy at least once. And ASHA agrees with us, believe it or not. So on the ASHA website, and this is a quote, SLPs may find application of ABA techniques within natural training contexts to be effective complements to their own communication interventions. So
It's real. Said it really well.
Yeah, it's real, right? Yeah. I mean, managing behavior is a very legitimate part of what we are expected to do. And to sort of take that one step further, I know I was going to say this to you. You know how I made fun of you a couple episodes back about how I hate reading articles, and I never read an article and then read another article. I read an article and it made me want to read another article and another article. And before I knew it, I was deep in a hole, like on like a totally different topic. So I found it reinforcing. The article reading just continued to increase. So to sort of just to piggyback on that idea about how, ASHA acknowledges that managing behavior is an important piece of what we do as effective therapists. It is also, I don't want to say part of the law, but if you work in the schools, there is evidence that considering positive behavioral supports could be part of your job. So an article by Keller, Bell, and Short in 2019, reference on our website. There's an article called Positive Behavioral Interventions and Supports in Schools, a Tutorial. It was published in Language, Speech, and Hearing Services in School. So it was in one of our journals. And it essentially says that IEP teams are required under IDEA to consider positive behavioral supports. And this is a direct quote from that article. It's imperative that SLPs in schools be familiar with and be able to implement federal recommendations such as positive behavioral interventions and supports in order to better support their students more effectively. So it is evidence-based practice. It is not necessarily in our scope of competence to go walking around and saying, oh, I can write you a behavior plan. I'm an expert in behavior. But it is part of our jobs to make sure we're considering these supports and implementing these supports to maximize treatment for our clients.
And I think, that obviously makes sense. Similarly, with the school framework, we expect classroom teachers to have, some degree of grasp on classroom behavior management, because it acknowledges the reality that if you aren't available for learning, then you're not doing your best learning.
Right.
And
That's a very good point. I mean, and I think that can be said as not necessarily as a condition of human nature, but I mean, not a condition of having a communication disorder, but a condition of human nature. I can remember one time in particular in graduate school, I may or may not have stayed out late. I may or may not have had too much coffee. I may or may not have felt like trash. I was not available for learning that day, and I did not do very well on the exam when that content was covered because I was not available for learning on account of my fatigue. So I think that, it's a really good lens to look at when you're trying to figure out a way to improve your practice at large. And I think, just as like a final note, every clinician has their bag of tricks. I never in a million years could have been a pediatric therapist doing direct service without my STAR chart. I used that STAR chart every single session. I used my visual schedule every single session. And sometimes it was awesome. And sometimes it was garbage. And I couldn't get the kid from under the table, or one kid smacked me right across the face one time. I had all my supports. So I feel like every speech pathologist has their bag of tricks, but knowing the science behind behavior management, I think, can really improve those bag of tricks, and to use the word that you used, put in those tweaks to make it better.
Well, and I think you make such a good point, right? And we'll talk more about this as the article, as we go through these different articles and go through the podcast, but it's not you that your STAR chart was magic. It's that those times when it was magic because of XYZ. So as a speech therapist who's trying to manage behaviors or maximize the efficacy of your session with your client, having a bit of a better understanding about all those variables and how they interact with one another can help you maybe better pull from your bag of tricks. But I think, that's a great point. Sometimes those things are so effective and you're so excited about how well your session went. And then sometimes like,
Totally. So we have two quick disclaimers before we really jump into the meat. So the first is, a lot of the content that's pulled from for this episode is pulled from an entry-level textbook on ABA by Cooper, Howard, and Heward. Heron. Reference on the website. I obviously didn't write that one down. But so just to use that as a backdrop, a lot of it, we're not going to say from Cooper, from the Cooper book, from the Cooper book, from the Cooper book throughout the episode. Vast majority of this content is pulled from that book. The second disclaimer is that this episode was hard to write because we could go deep. We could go deep on any one of these topics, and we are not going to do that. We could go deep, but we're going to stay shallow because we feel like it's important to give everybody a good lay of the land on how behavior management works. So if there's anyone out there who wants to learn more about any one of these specific topics in detail, send us a note, send us a message. We would be happy to do that. Okay, so on to our learning objectives. Are we ready for learning objectives?
I think we are. I think the only other disclaimer is that we're providing general information that you can use to make some clinical choices, but we're not providing specific information to treat a specific behavior problem that you may be seeing. Right. And we would encourage you to contact us or connect with a BCBA if you're fortunate enough to work with one.
A nice one. If you're fortunate
Yeah.
enough to work with a
And if you're working with,
open-minded and collaborative, nice one.
and if you have challenges, check out our podcast on
About
collaborating.
collaborating with BCBAs. Yes, exactly.
They have a lot of great information.
Yeah, we're going to go through a lot of examples, and you're right. These are just examples. We are not giving, we're getting very general information about behavior management practices. Okay, so learning objectives. We are going to go through 2 learning objectives today and 2 learning objectives in the next podcast. In the next episode. I'm going to read all 4. Number 1, learn the difference between reinforcement and punishment. Seems pretty basic. It's actually pretty confusing. I screw it up all the time. Well, not really, but learning objective number 2, learn about the different types of reinforcement, how to choose reinforcers and different schedules of reinforcement. That's what we're going to go through today. Next episode, learning objective number 3, understand how both antecedent-based interventions and consequence-based interventions can help improve client behavior. Number 4, review commonly used behavior management strategies and the science behind them. So,
Sounds like a lot of stuff.
it's a lot of stuff.
Sounds like it would be hard to squish
But
into
it's gonna be super fun.
super fun.
Super fun. Okay. Just randomly sing throughout the episode today. It's
Mhm.
cool. Okay, so learning objective number 1. Learn the difference between reinforcement and punishment. So there's a very quick history lesson that I'm going to try and sum up in less than 5 sentences. Let's see if we can do this.
Contest. Boom.
It's a contest. 5
I mean-
sentences? 5 sentences or less. Oh God, now you're going to count, aren't you? Because you're so competitive.
Yes.
Okay, so psychology was full of fluffy things back at the turn of the century. I'm not off to a good start.
No, that's like
So 1912, guy named Watson came up with the idea that there is a relationship between your environment and your responses to that environment. He came up with something called respondent conditioning. Okay, this is like Pavlov's dogs. Am I doing okay so far?
you got 4. Got 1 left.
Okay, so Pavlov's dogs. So you're the dogs see the food and they salivate, right?
Mm-hmm.
Okay, so there is a relationship between your environment, the stimuli in your environment, and your response to that stimuli. Another example of respondent conditioning would be a bright light shines and your pupils dilate. Respondent conditioning is very much a reflex. Fast forward to 1950s or so, okay? B.F. Skinner, we've all heard of B.F. Skinner. He comes along and he basically, for the first time, says that there are stimuli in the environment that elicit a response, right? So there's the bright light that makes your pupils dilate. But behavior is more significantly changed by the consequence that comes after the response than the stimuli that comes before the response. And this is the invention of what we call the 3-term contingency, or ABC, which we're going to walk you through.
And he kind of sorted that out as different from a biological response, right? So the physiological response of the bright light, like no matter how many cookies you get, that's still just what your eyes do.
Yes, we do love cookies.
I love cookies.
You're out of wine in your house. Maybe we should use wine as the
I know. I'm
as,
afraid to go to the
as
grocery
the
store.
reinforcer.
Wine is not enough to make me go to the grocery store.
It's not enough.
No.
But yes, so he separates the reflex component from all other behavior in this 3-term contingency. So he basically says that there are 3 components to every response. The acronym is ABC. There is the antecedent, or what comes before the response, the behavior. A.
Antecedent.
Antecedent. Then there's B, the behavior. And then
B.
there's C, the consequence. And
C.
Skinner says that the consequence has a very important role in shaping behavior. So an example of this is called the 3-term contingency, or operant conditioning, if anybody's feeling nerdy. But you have your A, your B, and your C, antecedent, behavior, and consequence. So an example, the phone rings.
Ring, ring.
A. There's your A. The phone rings. What's the B?
You pick it up.
You pick
Maybe
up the
say,
phone and you say,
"Hey,
what's up?
what's up?"
What's the C?
The social exchange that
Social
we
exchange.
have.
Somebody has something to tell you. Exactly. The social exchange, in Skinner's view, the social exchange is the consequence that has shaped the behavior or made it more likely that in the future, when the phone rings,
Ring, ring, ring.
you will pick up the phone. And I'm just thinking of another example for later.
Oh, good.
I'm going to write it down. So here's your three-term contingent. That's your three-term contingency, A, B, and C.
So if you're thinking clinically, right? I'm an SLP, I have this session. Is it just important for me to think about that consequence?
Both play a role,
Okay.
but they're related to each other.
Okay. So it's like a complex interaction between
It's
all of
the antecedent, what comes before the behavior and what comes after the behavior. There is an interaction there. But I think it makes the most sense to talk about the different kinds of consequences, which are reinforcement and punishment. Does that make
Right.
sense?
So yeah, it feels a little backwards because as we talked about, there's this A antecedent, B behavior, C consequence interaction. But once we get through this part, I think the listeners will understand why it makes sense to start here first.
Definitely. So I think it also makes sense to talk about how these are scientific terms. So we hear about, I have this argument with my husband all the time about using these words with my kids. So we think about reinforcement as being something happy, something that is, has feel good vibes around it, or something that's a reward, but that's not at all what it is. In the context of behavior, the science of behavior management, the word reinforcement has a scientific definition, which is reinforcement is when a response is followed immediately by a stimulus change that results in similar responses occurring more often. That's a direct quote from the Cooper, Howard, and Heron book.
And that's different from our colloquial understanding of that word. And I think one area where people can kind of run into trouble, because if you think it just means good, fun things, you might mistakenly think that you're reinforcing something. But according to that definition you just read, it's really only reinforcement if it means that behavior happens more often in the future.
Correct. So I think as a parent, I get into this all the time where, my husband, my son will do something. Sorry, my poor son. I'm like, he's too young to defend for himself. And I'm like throwing him under the bus, but he will do something unwanted. He'll throw a toy or do something. And my husband will yell at him or speak firmly to him or do something. And he's like, well, he needs to be punished. But that behavior increases. So, my weasel of a little boy who has all the joy in my heart, what my husband doesn't understand, and I'm really throwing him under the bus here too, is that is, or what he understands now, but didn't before we had so many discussions, was that yelling was a reinforcer because it made the behavior increase. So just to hammer that definition home again, reinforcement is when a response or behavior is followed by a stimulus change or it's followed by something that makes the behavior increase or occur more often.
Kate, I think that that's such a good example. The yelling is such a good example because for me to look at that with my layperson eyes, like that obviously seems like punishment.
We want it to be punishment. I yelled at you. I'm mad. I just told you to stop biting me on the feet or whatever weird thing you were doing in your weird 4-year-old, 3-year-old mind.
Yes.
But if me yelling at you makes you do it more often, then it is a reinforcer by definition. And I think it's really important for the layperson or the speech pathologist or whoever to understand that these words, reinforcement and punishment, have scientific definitions. So what's what reinforcement is, and a reinforcer is it's the noun, it's the stimulus change that increases the future frequency of a behavior. And I think as speech pathologists, this has happened to me multiple times. I have some sticker chart, or I have some quote reward that I'm offering at the end of a particular behavior I'm looking for, like an accurate production of S sound, or the accurate use of a syntactic structure, or eye gaze shifts, or whatever my target behavior is, and it's not working. The response isn't going up. The behavior is not being affected by this sticker chart or by this star chart. And that's because, based on this definition, those items are not reinforcing.
Right. So when you think to yourself, but I'm reinforcing it, what's going wrong? The token is the reinforcer. The star is the reinforcer. Why isn't it working? It's not.
It's because
Correct.
it's not a reinforcer.
It's not
Right.
reinforcing.
Exactly. And I think those casual interpretations of reinforcement apply to punishment too. So that same example with my son, if we think of it as punishment, it's only punishment if the behavior goes down. So looking at the different kinds of looking at punishment that's out there. So punishment is sort of the opposite of reinforcement. It's a stimulus change after a behavior that makes the behavior decrease. So something is only a punisher if the behavior decreases in the future. So same example, it's not a behavior. It's child does something naughty, parent gives lots of attention in the form of yelling or a lecture, or this is why we don't do these things, and the behavior goes up. You think of it as a punisher, but it's not a punisher. Now, if the behavior goes down after you've yelled or after you've made a fuss, then it was an effective punisher, because by the definition of punishment, it's a stimulus change after a behavior, the consequence, ABC, BC, consequence. If the behavior goes down, then it is a punisher.
And I think just a couple of things to note are timing is important too, right? So it needs to happen, the punishment or reinforcement needs to happen pretty immediately after the behavior for it to be effective.
Yes.
In most cases, again, we could go deeper in this, but broadly, you
Right.
kind of want to deliver that within 2 seconds of that behavior.
And maybe we can touch base on this again when we talk about different kinds of reinforcement, just to sort of loop it all home. But in order for reinforcers to be effective, they should be delivered as close to the response as possible, as close to the behavior as possible.
And just one more thing, when you talk about that behavior goes down, that behavior goes down in the future, not necessarily in that moment. So the next time he doesn't get the lollipop and you yelled at him last time, he's less likely to try and bite your toe or whatever the example was.
My children don't bite my feet.
No.
It was a weird example, but I think everyone sort of gets the point. So now that we have this basic understanding of what in the scientific definition, the basic understanding of reinforcement and punishment. There are two different kinds of reinforcement, and there are two different kinds of punishment.
And this is where it gets kind of confusing.
This is just to make it more confusing.
Yeah.
So there is positive reinforcement and there is negative reinforcement. There is positive punishment and there is negative punishment. Now, we have a graphic organizer that we are going to put up on the website. It's a little chart that can help explain some of these differences.
Because just listening, negative reinforcement sounds like an oxymoron to me, right? Negative reinforcement.
Well, when you have that definition of like, oh, reinforcement is happy and it's negative, well, then it must be a bad thing.
Yeah.
It must be a terrible thing.
Tell us more.
So positive reinforcement is when something is added after a behavior that increases the future frequency of that behavior. So let's go straight to a different example that's specifically related to speech therapy. So you're running articulation drills. You hold up a flashcard and say, banana. They imitate you. They say banana. Wonderful. But they do not and they do exactly what you wanted them to do. They said a clear bus sound. They said banana the exact same way that you want them to say it. You say, great job, and you put a sticker on their sticker chart. The next time you show the flashcard and say banana, if they are more likely to say banana, then the sticker was that was positive reinforcement. You added the sticker. You added something to the situation. You added something to the ABC. The C had something added. the behavior went up. That is positive reinforcement. Negative reinforcement is when something is removed after a behavior that increases the future frequency of that behavior. So let's talk about the same scenario. You present the flashcard, you say banana, you present the flashcard, you try and provide as many prompts as you can to get your client or student to say banana, but they hit you instead. Smack you right in the face. You decide that therapy is over. You can't handle it. You move all the materials because you cannot work under these horrible circumstances, and the session ends for the day. The next time you show the flashcard and say banana, if they hit you again, then they successfully escaped work, and that behavior was negatively reinforced because you removed the demands after they hit you. So negative reinforcement is where something is removed after a behavior that increases the future frequency of that behavior. Okay, so let's do another example. That was a very speechy example. So another example we had used in an earlier podcast outside of the speech room that was very concrete was you bring your child into the grocery store, you put the child in the grocery store cart, and the child starts tantruming, and you decide everybody's judging you. This is a horrible experience. Everybody's looking at you. You're causing a scene. You're exhausted. You don't have time for this. So you take the child out of the cart, you leave the store, and you go home. The next time you put the child in the grocery cart, if they keep tantruming, if the tantruming goes up, then you've just negatively reinforced that behavior because you removed the unpleasant stimulus of the grocery store cart, and the behavior increased.
Yeah, that makes sense.
It's very confusing.
It is
I have a really hard time with these sometimes, all the time.
It's confusing. But I think it's helpful to think about, from a lot of perspectives when you're in the speech session, because a lot of times what we want to do is increase behavior, and that is reinforcement. And I think that being aware that the things that we're doing that we think are reinforcing might not be reinforcing, or the things that we're doing may be reinforcing, but we may be reinforcing something that we don't want to reinforce. I think just having that awareness can really help when you're either anticipating or trying to work through some behavioral challenges.
Yes, definitely. So that's reinforcement, positive and negative reinforcement. All of reinforcement is making a behavior increase. The only difference is that positive reinforcement is adding something after the behavior. Negative reinforcement is removing something after the behavior.
And something that helped me when we were learning about this was to just think of it, to visualize the mathematical symbols, right? So positive means plus. It doesn't mean good. Positive, plus, negative,
you're adding,
minus.
right?
Mm-hmm.
Adding and subtracting. So let's talk about punishment. So both different kinds of punishment mean that the behavior goes down. Positive punishment is similar to positive reinforcement in that you're adding something after the behavior that makes the behavior decrease. So as an example, you present the flashcard, same scenario with the kid in the therapy room. You present a flashcard, you say banana, and your client smacks you in the face. That happened to me one time. It wasn't around the word banana, but I've been hit many times. And you weren't expecting it, and you scream. You scream really loud because you have no control over yourself, and you're maybe not being a great therapist. I don't know. But the child gets very scared from your screaming. And in the future, the hitting is less likely to happen. In that situation, you added a component, the scream, that made the behavior of hitting less likely to happen.
Yes. And I think for us to recognize that really we're focusing on reinforcement in our clinical
We don't scream at our clients.
But sometimes people do. No, we don't scream at our clients. We might scream at our family members. But
which we shouldn't.
We shouldn't.
But we do.
We shouldn't. But sometimes things happen.
I never yell at my kids. What are you talking about? Never.
Never.
Not one time.
Never.
So glad no one can see in my house. There's no cameras.
But when I think it's helpful to be very aware of this, because there are other things that we could do, that we could be adding to the situation that are not as clear cut as screaming. and
Right.
seem totally appropriate and still reduce the likelihood of something happening in the future.
Right.
Okay, last one, the minus.
Negative punishment. So we have this now that we've gone through our pluses and minus, negative, positive, and reinforcement. I think it's hopefully people can extrapolate that negative punishment is when something is removed after a behavior that decreases the future frequency of that behavior. So, just moving on with our same scenarios here. You're running articulation drills and you give them a sticker. The student or the client earns stickers in your office. And you hold up the flashcard and you say banana, but you get smacked instead of the child repeating the word banana. And you don't scream at them because you've collected yourself. You got enough sleep, you had enough coffee, but you do take a sticker away. The removal of the sticker was the removal of the consequence. It is a punishment if the hitting goes down in the future, if it is less likely to happen in the future. Now, we were talking about this before we started recording about how once upon a time when I was a youth, we would lose recess minutes.
Yeah, I totally lost recess. We had to sit on the wall. You had to sit on the
Ooh, you
wall.
just sit. I
You had
didn't
to
get like
sit
a
on the
dunce
wall,
cap, but
and you
I
had
didn't
to
have to
like
sit on the
watch
wall.
all the other kids play. It was brutal.
Oh, that is brutal.
Yeah.
But we don't really do that anymore.
I don't think so.
No. So, and I think this is a nice segue. Now that we understand the different kinds of positive and negative punishment, I think it's a good thing to acknowledge that you should not use punishment. So, as a clinician, and this is another whole body of research that we're not going to get into, but using punishment has a whole host of side effects associated with it. There are a whole host of ethical reasons why you should not use punishment. I think it's important to understand what it is and recognize it when you see it in case things are being accidentally punished, which I think happens a lot. I have one little story in particular about myself. So I was a new clinician. I had just gotten a job at a fancy hospital. I was feeling real good about myself, and I had this cute little kid. I was like, I am gonna make this kid love me. This is gonna be so great. And the first time he got an answer right on an assessment, I cheered really loud. I threw my hands up in the air. Yay! That child cowered. He was horrified by me. He was very socially anxious. And I couldn't get him back. I couldn't get him to continue responding throughout the course of my testing because I had punished his responding by screaming really loud. I had the best of intentions. I was trying to be so happy. So I think it's important to recognize it and understand what it is, but it's not something that we plan for.
And I think that that's such a great example because most of us know that there are different personalities, whether you're somebody with communication needs or not. We all have different things that we enjoy versus don't enjoy. I mean, some people like skydiving and roller coasters. And for
No,
those
thanks.
people, skydiving and roller coasters might serve as a reinforcement for skydiving and roller coastering. For me, no, thank you. And being aware of exactly that. I mean, I don't know who is a pediatric SLP, at least, who hasn't had a very similar experience to that. Like, oh no, I celebrated a little bit too big, and now my client doesn't want to answer me because they're afraid I'm going to celebrate and scare them.
I mean, this poor
Such a
child,
beautiful
all
thing.
he wanted was to be left alone and to be like,
Mhm.
I don't know if it was a sensory thing and I was too loud or if it was
Mhm.
an attention thing and he was feeling anxious. But I think it's very important to acknowledge, to just understand what punishment is, but don't plan on to use
Right.
it.
Don't plan on it, but be aware of it so that if you're doing it inadvertently, you can stop yourself.
Right. Exactly.
Yeah.
I think when you get into, I mean, just sort of on the piggybacking onto that, reinforcement is where it's at. We always want to use reinforcement when trying to shape behavior. I think if you are ever in a situation where you have a complex learner or a student where, you've taken this information about positive, the different kinds of reinforcement and punishment and tweaked some things in your already existing bag of tricks and it's not working, and you are having a hard time figuring out how to get a particular, like a unwanted behavior removed, talk to your BCBA, talk to whoever is in your established organization who is writing the behavior plans, get more brains involved. I think we don't want to go using components of punishment willy-nilly to try and get behaviors, unwanted behaviors reduced in a speech therapy session without some sort of guidance.
But if you are working with somebody who, let's say in that example, you've got your articulation example and your student or your client hits you and that's unexpected and you're outpatient and you don't have access to a BCBA, I do think that being aware of not reinforcing something is important, right? So in that example, when the student hits me, instead of saying banana, there's really two things I want to do.
Banana.
Right? I want to increase the likelihood that they're going to say banana. So I want to take a look at reinforcement. I bet that the things that I think are reinforcing aren't.
Right.
But also with that, don't want to reinforce the hitting either.
Right. And I think that you just want to be careful when you're saying, okay, I want to actively try and put some procedure in place to get the hitting to go down that is based in punishment. That is just not something that you want to do. You always want to use reinforcement, I think, is like the biggest takeaway to knowing that, oh, there's this scientific thing that can make unwanted behavior go down. Yes, there is. But there's a whole host of reasons why you don't want to root any behavior management plan and punishment.
So is there anything else a person can do? What about extinction?
Yes, this is an excellent segue into extinction, which is a good bet. I feel like this happens a lot without understanding what it is. And we have a couple of examples. Okay, so going back to our little chart, we have positive and negative reinforcement and punishment. There is this one extra thing that's not really reinforcement and it's not really punishment either. And it's called extinction. And
tell us more about it.
Yeah, maybe a word that people are familiar with. So,
not dinosaurs.
No, it's not dinosaurs. It's not dinosaurs. So extinction is when a previously applied reinforcer is removed or discontinued in order to decrease or eliminate a behavior. Okay. So you have a behavior that had an ABC, right? So it had a C. It was reinforced for a long time. And when you remove the reinforcer, the behavior will go down.
Which is different than punishment.
It's different than punishment because you're not adding the consequence or removing the consequence for the first time. There was an established reinforcer in place already, and you're removing that established reinforcer. So there is something associated with extinction called an extinction burst, but I think it's best illustrated in an example.
Okay.
So let's say you have a little client, Johnny, and every teacher, every therapist, every adult that's ever worked with Johnny has made a huge fuss every time he hits people. So every time he hits somebody, one of his friends, one of his little peers in his classroom makes a big fuss, or a teacher comes over and gives him a big long lecture about why he shouldn't be hitting people. He gets out of work, he doesn't have to do his spelling. He doesn't have to do his worksheets. He gets a whole lot of attention, and this generally speaking, it's negatively reinforced with the removal of different work tasks, but it's also positively reinforced with additional attention from people.
So there can be multiple pieces at play. Right. So it could also be the grocery store example. Mom leaves the grocery store, but also gives you a lecture on the way out to the car.
Right.
That's plus lecture minus grocery store.
Right. So Johnny is hitting and getting ABC. He's hitting and he's getting all of these consequences. He's getting lots of reinforcement for the hitting in the form of removal from work demands and lots of attention from his peers and every other adult. So Johnny comes into your session and you heard ahead of time, he hits. And you decide that you're going to not give him any attention for the hitting, and you are going to keep presenting the demands no matter how many times this happens. That is removing his reinforcers. So what is going to happen? You do those things, you ignore the behavior, you keep the work materials present. Johnny is going to keep hitting you. Johnny's rate of hitting.
We just said the reinforcers made it happen more often. What's happening here?
So when you remove the reinforcers, the rates of the behavior will go up, and it's called an extinction burst, but it's temporary. So they go up before they eventually are reduced or eliminated.
So can you give another example?
My favorite example that I always give to families is the Coke machine, or like the snack vending machine. So since I was old enough to put a quarter in a slot, I have put my money in a Coke machine or a bag of chips machine, and I press my buttons and I get my chips.
Okay, so your ABC there is like you see a Coke machine, you're thirsty.
I'm hungry.
Whatever. Behavior, you put your quarter in the Coke machine. I wish it cost a quarter. You put your quarters in the Coke machine.
We're dating
and
ourselves.
then consequent positive reinforcement plus a Coke. You get a Coke.
I get my soda, or my bag of my delicious bag of Cheetos. I love Cheetos.
Getting very hungry.
Cheetos.
Okay.
Oh, I love Cheetos. So what happens if my Cheeto bag gets stuck in the machine?
Ooh,
How annoying is that?
the worst.
There's my reinforcement just got stuck in that machine. My reinforcer was removed. What happens? Do I just go, that's too bad, and walk away? Not likely.
All the things, right? You try all the things. Maybe you try putting more money in. Maybe
I get more money. I go complain to somebody who's working at the whatever ice rink or wherever I am where the vending machine is. I'm going to kick the Coke machine or the bag of chips. I might do that sad, pathetic little Tyrannosaurus arm where you stick your hand like up the machine and sort of wave it around, trying to reach it. You tilt it. Your response effort, your responses, your rate of responding goes up, trying to get access to the chips. So your reinforcer was removed and your rate of responding increases until eventually I give up and I walk away.
But before you did that, you tried all these other, first, maybe you tried just putting more money in, or maybe you tried like pressing that little button, getting your money back, putting that back in. And then you tried other things that maybe weren't even the same behavior, right? So you tried jostling and kicking and all these things. So does that mean in our example with our little guy who's hitting, like maybe he might even do other things? He might rip up your
He
flash
might
drive.
up the ante.
Okay.
If the reinforcer he was after was attention, and this has happened to me, it started with a little like, I'm just gonna pinch your hand. You're not gonna pay attention. But now I'm in like full attack mode. I'm gonna be trying to pull your hair, do all these things. And I should also say we're using an example that is rooted in aggressive behavior. And I think it's really important to acknowledge that when you use extinction, there is going to be an extinction burst. That rate of responding is going to go up. And you have to be very careful. You don't want to use extinction with a behavior that if it goes up, somebody could get hurt. Right. So if you have a kid whose behavior of choice is headbanging or hitting you and they're 10, or larger, or they're hurting themselves, or they're hurting someone in the classroom, or they have the potential to hurt, any of these things could become dangerous and unsafe. That's something to consider before deciding cold turkey that you're just going to ignore it.
Right. And I think back to, those are times that you should really consider trying to reach out to outside resources. In my example, in my head, our little client who's working on saying banana, is a little guy.
Exactly.
Right.
And another example, this is another student that I used to work with. I've had a handful of students who have burped on purpose or cursed on purpose. And those are things that, I can listen to Johnny burp for 10 minutes. It's not going to kill me. That's not something that's going to be dangerous. If his, response, the form of his response changes, I need to be aware if it's, there's a risk for it to become aggressive or self-injurious.
And I mean, there could be even less noticeable examples like I'm just choosing not to respond or saying no thanks or, there's a whole continuum of much safer ways that you may, see these challenging behaviors. They're
Right.
not all. They're not
And
all.
one other word about extinction, just if you're choosing to, I think in my personal experience, a lot of it has been attention maintained. So it becomes a matter of ignoring the behavior. If it's safe, you feel, comfortable ignoring it. Little Johnny is burping or, being silly or, something that is totally safe with maintaining. If you have decided to ignore it, you have to commit to ignoring it. So let's say little Johnny is doing his best work at getting under your skin and he's calling you names or he's, making dragging his nails down a chalkboard and you're just like, ugh. If you are deciding that you are going to ignore that behavior or you're deciding that you're going to remove whatever the reinforcer is, you have to commit to it, because if you let little Johnny do it for 10 minutes and then you decide I can't take it anymore and you give him the attention, if that's the reinforcer, or you remove the work materials, which is what, he's trying to get out of it, then basically what you just said was, all right, well, you have to do it for whole 10 minutes and then you'll get what you want. So you actually reinforce higher rates of the behavior that you're trying to extinguish. So this is something that is, I think, really important to keep in mind, that if you choose to use extinction, you have to be prepared for the extinction burst to really ride it all the way through. Also, just piggybacking onto that, you should be using other other reinforcement systems to replace the behavior. So you're not just using extinction in a vacuum. You're not just like, I'm going to ignore you and, keep these work demands. Consider having a star chart or another system in reinforcement to reinforce compliance. So not only are you ignoring the burping, but every time you get a compliant answer or every time you sit in your chair, you're also earning all of these stickers. So you never really use extinction by itself. You always use it in conjunction, and we probably should have said that first. You always use it in conjunction with a reinforcement system.
I think that's such an important point that you made right there. So just to say it one more time, you're never using extinction on its own. You're always also trying to teach whatever it is that you would like the person to do instead. And we'll talk a lot more in the second part of this podcast, but just as a teaser, you also may find that you're using some antecedent strategies. So in that ABC relationship, we're talking in this episode about all of the C pieces, all of the consequence pieces, but there are also things that you could do in the antecedent before, to try and reduce that behavior even before it starts. So
Yes.
it's part of a package.
Right. And I feel like I can't drive that point home enough. And if you're working in a school, if your institution uses positive behavioral support systems, you are always going to have an emphasis on you always should, even if your institution or maybe you're in private practice, you should always have an emphasis on teaching replacement behaviors that are pro-social, that improve quality of life, that are cusp, you know, behaviors that open doors to other more lifelong beneficial experiences, all of those kinds of things.
And I think, we've talked a lot about BCBAs, and part of that is just because of the population that we work with. But there are, for people who are in a school, know your resources. You might have a behavior specialist or a classroom teacher who does a really nice job with classroom behavior management. Reach out to people who in your work environment who do a great job. If you're outpatient, maybe there's another clinician there who, does a really nice job with clients who may have a harder time behaviorally. Just connect with the resources that you do have.
Definitely. I think this is maybe a good time to go quickly through learning objective number 2. So now that we know what reinforcement is, what are the different kinds of reinforcement and how can you choose reinforcers, and what are the different schedules of reinforcement? I think we know what reinforcers are, we know what punishers are, and I think we've already reviewed that a reinforcer is only a reinforcer if it increases the future probability of that behavior, if it's presented after a behavior and it increases the future probability. Just because we think something is reinforcing doesn't mean that it actually is. We've gone through a couple of examples. There are a couple of different kinds of reinforcers that you can consider using, but I think what might be most helpful for our listeners is to talk about how you can identify what something that might be reinforcing, and also how often you should give a reinforcer. So, in terms of identifying when you give in terms of identifying what might be a reinforcer, there are a couple of different ways that you can go about doing that.
And I guess a point that I think is helpful to think about is that reinforcers aren't static. So for our clients and for ourselves and for everybody, it's a dynamic process. It changes over time. So something that you identify as, a reinforcer, you guys can't see my air quotes, but a reinforcer, on Tuesday, the 15th of November, is not necessarily going to be a reinforcer even later in that same session, never mind, 3 months later.
Right.
So it's a process you want to be continually engaging and kind of assessing whether things are actually functioning as true reinforcers or not.
Right. And I mean, I know we've sort of joked about this earlier in the episode. I would work for wine today and tomorrow and the next day, but at some point I'm going to get really dehydrated and really
Mhm.
tired. So reinforcers do change. I've had a coworker say to me once, you can only pay me in chocolate cake for a day, because after that she's going to be satiated on chocolate cake and no longer want chocolate cake. And I think that's why it's a really good thing to consider when you're working with clients who have varied interests, that they might want to work for one, something that's reinforcing on one day might be completely different from the next day.
And we'll get much more in depth on this in the second part of this podcast, where we also talk about things like motivating operations, which are something that kind of overlays on top of this whole ABC relationship that changes,
Basically motivation, what you're motivated for.
Right. What you're motivated for in that moment and kind of how reinforcing different things are. But all right, so I'm in a session. I have somebody who, I want them to try something that's really hard for them, and I want to make sure that there's really something that's equally strong that they're going to be reinforced by. How do I figure that out?
Well, I think there's a couple of different, this is again a whole science, different
Mhm.
reinforcer assessments, preference assessments. If you have access to a BCBA, you could get some information from them about how to conduct a reinforcer assessment or a preference assessment. They're not too terribly time consuming. Um, there is some value in having your client choose their own reinforcer. So if they are able to select from an array of icons, or select a toy, or select something, that might be something to consider. If it's something that's chosen by them, it's more likely to be reinforcing. Asking the parents. So parents know their kids. If they, so if the parent says, oh, Johnny will do pretty much anything for Power Rangers, maybe that's something that you could incorporate. But to your point, if you're asking someone to do something that's incredibly challenging, they need to be fairly compensated for their work. So you want to make sure that the reinforcer that you're using is fairly paired with the level of work that they are putting in.
And I feel like you use two different terms back there that we should just talk about a little bit. The difference between, and there is a difference between a preference, which is something that you like and would pick, and a reinforcer, which is something that increases the future frequency of a target behavior. So for me, I don't know about for you, but for me, a lot of times what I do, because there are structured, if you go on Google, you can look for structured preference assessments, and there's a lot of different ways that you can do that. I do a lot of informal just choice making, like holding up two things, or like you said, a picture of two things, or, for people who are literate, giving somebody a list and asking them to rank, in order of their preference, all of these different activities or items. Sometimes things that are preferences are reinforcers and sometimes they aren't. And that gets into how complicated or challenging the task is, and all of these other variables about who that person is in that moment, in that time. But I feel like starting with preferences is a good place, and then you can kind of use your clinical data to make choices about whether that's actually working as a reinforcer or not.
I was just about to say, I mean, you can always use your data. So by definition, a reinforcer is something that makes a behavior increase in the future. So if you use a preference assessment or you've talked to mom and you've gotten some ideas on some things that might actually be reinforcing, you will know from your data if it is working or if it is not working.
So you talked about schedules of reinforcement. So let's say I did a preference assessment, or I talked to mom, I found out Power Rangers are where it's at. We are going to do our articulation cards, and then we're going to play Power Rangers, and that's awesome. And we're making progress, and we're moving through all of these sounds. We're doing more complex word shapes, and we're playing Power Rangers, and we're playing Power Rangers. At some point, you can't always just play Power Rangers, right? So how do you figure that out? Like,
You
do
mean
I
like
go
how
from
often do you play Power Rangers?
how often do I play Power Rangers? Like, when do I bring out the Power Ranger?
So I think there's a couple of different ways to look at that. I definitely think you consistently reevaluate what reinforcement you're using. So just because Johnny loved Power Rangers on Tuesday doesn't mean he's going to love them on Friday. So continually, we do this a lot in the PEX trials. So let's say, Johnny loves goldfish. I have one student who will pretty much do anything for beets. So everybody is different. But you can't eat beets all day long, right? You have to have varied reinforcement. So constantly doing a reinforcer assessment or a preference assessment throughout different sessions is really important. Picking something that is paired with how much work someone is doing so that they are, you really want to make sure that the reinforcement is potent is the word that we would use. So maybe isolate if it's something that's incredibly challenging and you've identified that Power Rangers is the coolest thing in the whole world, maybe tell mom, all right, well, maybe if you could not let him watch a Power Ranger video for 2 days before you come to my session. I know we're getting into like the A, which we're going to get into more during our next episode, but making sure that that reinforcer is potent and it's powerful for something that's particularly challenging. But in terms of the question of how often to deliver reinforcement, we've already reviewed that you should deliver reinforcement as close to the response as possible. So if that kid produces the best R sound you've ever heard in your entire life, they should be getting that token right away, or they should be getting that high five right away, or they should be getting that tiny piece of cookie or whatever it is right away. So you want to deliver reinforcement very close after the response. When you are teaching a new skill, or when you are teaching a skill, I think that is particularly challenging, you want to use maybe even a dense schedule of reinforcement. So they're getting a lot of reinforcement, but also after every single instance of that behavior. So maybe for the R sound, which is particularly challenging, every time they produce it correctly, you are giving a token every single time. Every single time they are sitting in their seat for 15 seconds. If they, little Johnny comes in and he cannot sit in his seat, you want to give them reinforcement as much as possible at every single instance. It does depend on the behavior that you're trying to reinforce. I just gave 2 examples. So one is related to a ratio. So every time you lift your tongue to produce an L sound, that's one instance. You would provide reinforcement for every instance of that behavior. The other example I gave of Johnny sitting in his seat, that's time. That's an interval based, that's a time related behavior. This is particularly true for a lot of my students, where they're up and about and running around and not really available for learning because they're looking out the window and all these other kinds of things. If you see that Johnny can sit in his seat for 30 seconds before he's up, that's his baseline. Maybe give him the token or the edible or whatever it is at 20 seconds, right? So you want to provide the reinforcement at the level where they are immediately after they do what is reasonable to them. Does that make sense?
That makes so much sense. So basically, you want the client to have a lot of opportunities to get that reinforcement. You're getting it all the time at first. This is new, this is hard, and we want our expectations sort of to be within your zone of proximal development, right? Where you're talking about, with the sitting in the seat. We don't want to, if you sit in your seat for 30 seconds, 60 seconds is not a realistic starting point, and it's going to, your client isn't going to have a lot of opportunity to get closer to that goal and be reinforced.
Right. So let's learn from one of my mistakes here. So I had, just as an example, I had a little kid who, let's just go with the Power Rangers example. It was a different video, different cartoon, but loved Power Rangers. Pretty much was obsessed with them. Wore their clothes all day long. And I brought him into my session, and I was like, "This kid's gonna love me. I'm gonna give him Power Rangers. It's gonna be great." And I had a star chart out. It was my first session, and I had 5 stars. He had to earn 5 stars before he got his video of Power Rangers. And I got him in the seat, and he did something great, and I gave him a star, and the rest of the session was a complete disaster. And I was like, but I have so many Power Rangers. Look at all of these great things. What I was missing was that I should have given him the Power Ranger video the first time he did what I asked, because the star itself was not reinforcing. It was an unconditioned reinforcer. That star had no value. I had to teach him that the star had value by pairing the star with the video of the Power Rangers. So you want to make sure that, again, you're delivering the actual reinforcer closer to the behavior that you want to increase. Over time, I could have, "Oh, Johnny, you sat in the chair, you said this great TH sound. Here's your star and the video. That's so great. Maybe the next session or later on the section, here's your star. Let's do one more. Oh, here's your second star. Now you get the video." So we're increasing slowly the amount that he can tolerate before he gets the reinforcer. You have to make sure that you teach. If you're using unconditioned reinforcers or tokens or stickers or something, you have to teach. Sometimes you have to teach the student or the client that those items are reinforcers, or you have to teach them that they're conditioned reinforcers. You have to pair them with the item that you want to be reinforcing for them to have power.
Because I think nerdy terminology segue. I think an unconditioned reinforcer is stuff that is just always reinforcing to people, like food and drinks and things like that.
Yes, it's so stars have no meaning unless you teach me. Stickers have no meaning unless you teach me. Unless I inherently love stickers or inherently love stars, they have no meaning unless they are paired with something that has reinforcing power.
Well, and that's true. I mean, money, right?
Yes.
That's true for money. A bunch of dollars doesn't actually do anything for you. Can't eat dollars. You can't, I mean,
or if someone gave me a currency from a different country, that has no value to, I can't spend that. I'd have to go convert it. You know what I'm saying? So you have to make sure that the reinforcer you're using, if it is a token, if it's not something that is already established as a reinforcer, you have to pair it with something that is reinforcing to give it value. And then you can slowly thin it over time, is what we would say.
So just to recap, reinforcement has to be reinforcing. So it has to meet those descriptions we said earlier, has to increase the frequency. Reinforcement, when we're first teaching you something new, we're giving you lots and lots of reinforcement every time.
Yeah.
Every time. And that might take the form of things like stars. If you understand what the stars are, that might be getting a video. That might be just saying, "Great job, you did a great job." But it should be every time so that it's clearly following that behavior every time. But over time, slowly, incrementally, so the client has so much success, we're fading that out.
Yes, you want to set them up for success. So in my example, if I had given Johnny the star and the Power Rangers video in the first session, and it went really well, and by the end of the session, he was like, "Oh, this star is awesome." The next time he came back, I was like, "All right, buddy, 5 stars. You got to wait." That's so not fair, right? He has to learn, okay, first it's 1 star and I get the Power Ranger. Then it's 2 stars and I get the Power Ranger. Then it's 3 stars and I get the Power Ranger. So you have to teach them slowly over time that they have either a delay for their reinforcer or the stars become reinforcing, and you might give it every time they say the TH sound, or every third time they say the TH sound, or every second time they say the TH sound.
Well, and I think we're going to talk more about this in the second part of this podcast, but there's also a piece that what you're doing is you're becoming reinforcing by doing that, by being a place where your client comes, they're successful, they get access to all of these reinforcing activities or items. You, just like the star chart, you're always there too, and you're the person who's, providing access to all of these things. And I think as a speech language pathologist, this is something that we all know about, and we
Mhm.
think about establishing rapport. We just don't think about it in this framework, right? I mean, clinically, and you learn over time that of course you don't want somebody to come in for their initial sessions with you and have it be a bad time for them. You don't want your client to feel badly. You don't want them to think that you're a bad experience that they don't want to come back to. And so I think that's sort of an added plus about doing all of these things that you just explained about reinforcement, because by using that framework and in being, delivering these high rates of reinforcement at first and making sure your expectations are reasonable and manageable, you're also making that client's experience with you a better experience for them.
And that's so important. We want our clients to enjoy therapy. We want them to, feel like I can achieve this, I can accomplish this. Look at all this great stuff that I've gotten from working so hard. There's that sense of productivity and that sense of, like strong sense of success.
And because we're all individuals, what that looks like is so different for everybody. In your example where you had that big celebration for your client, another client, that
Oh my
that
God, they
could have
want a
been
party.
amazing, and they love it, and they love the Kate Circus show. And so that's part of what you're doing as a clinician too, is you're trying to feel out what are those real reinforcing things that make this a great place for this person to come.
Totally. I feel like that I think that maybe wraps us up. I feel like this was very dense. I didn't make too many mistakes. so so hopefully our listeners will walk away from this with a little bit of knowledge about, if nothing else, what reinforcement and punishment is. And stay tuned for our next episode, where we're going to go through our final 2 learning objectives related to commonly used behavior management strategies, the science behind them, and different antecedent management strategies.
Yeah, come
Hooray.
back.
Yeah, come
Stay
back.
tuned,
Come back and learn with us more.
because you've learned half of the ABC relationship, and the first part's important too.
There we go. Well, thank you for joining us, and we hope to see you or hear you or something back here again sometime soon.